So I'm hoping that decision makers in large healthcare systems will listen to this. I'm hoping that people in charge of public health will listen to this, but I'm also hoping that the people who do the implementation work,
Mm.
because we do try to be practical. And so, you might be an executive with, Medicaid at the state level, or you might be somebody who's actually administering specific programs. You're the program director for specific programs under Medicaid. I'm hoping that these people will be listening, but also that, I'm using kind of the state or the federal, but we're also looking at commercial, and I'd love to have commercial, leaders from commercial healthcare paying attention to what we're doing, because I believe that they will find this to be beneficial, that it will be informative, and it will teach them things that maybe they haven't heard of,
Mhm.
and give them new ways of looking at, new problems and old problems. I don't know. What do you think, Ben?
Yeah, I agree with you there, Mike. But I also think our intended guest will almost mirror our audience. And so what I mean by that is, we want our audience to also be a mix of health IT leaders, policy experts, entrepreneurs, and innovators. Anyone who's involved in building the future of more connected care. Uh, I would expect to have voices from government health organizations as well, maybe EMR and technology vendors, startup founders, like we mentioned, and physicians and clinical experts. So the idea here is to bring these folks together and allow them to have conversations of their own, maybe find each other through our channel, and working together to build a better, more connected healthcare system.